for you. So Jenna Flynn is our speaker today. She's a public health educator at Marathon County Health Department, just to our north a little bit in Stevens Point. And she's also the coordinator of the Nicotine Prevention Alliance of Central Wisconsin. So Jenna, I will let you take it away.
All right, thanks everybody for having me this morning. Hopefully display is a-okay. We are going to talk about today a general overview of what our alliance has been working on, general tobacco trends. I know we've done presentations for this group in the past, mainly focused around e-cigarette trends. We're going to broaden that a little bit and talk about tobacco overall. And then I probably won't pay attention to the chat too much, but please put questions in there because I think someone is, Elizabeth or Connie, and we can definitely address, but I'm going to try to talk as little as possible and kind of breeze through this content. So we're going to go ahead and kick off here. So just for those of you who either get our updates or are familiar with our coalition, we recently changed our name. So we went from the Central Wisconsin Tobacco Free Coalition to the Nicotine Prevention Alliance of Central Wisconsin. So you might see different logos coming in, or it's the same. We service the same 3 counties, Marathon, Wood, and Portage. Just giving the coalition a facelift. When we applied for our grant funding, we used the term alliance. It's just a fresher, something a little bit newer than coalition. It's essentially, all the same work, the same mission and vision. Our website is still going through updates too. So if you see some things that are old and some things that are new, that's why we're still in that process. And then this kind of gives you an idea of the coalitions across the state. So anything in blue is covered by a local tobacco coalition. The gray colors are service areas that don't have a local coalition. They either didn't apply for funding or they didn't receive funding, and that's up to the state to provide technical assistance. And we often get outreach too with neighboring counties like Clark and Langley looking for resources, and we're happy to provide them too. It just kind of depends what it is. The orange ones are some of the smaller coalitions, a little less funding, and then anything in green. This map is kind of, they have it laid out a little different than they have in years past, but those are some standalone FACT groups, which is a youth prevention group that works on tobacco. We have one of those too in Wisconsin Rapids, but it's not standalone. It's funded under our alliance. So in order to ground us today in the difference between commercial tobacco and traditional tobacco, I'm going to play a video and then you all can sit back and have some coffee and get your bearings straight because it is 8 a.m. But we've been doing a lot of education around traditional tobacco versus commercial tobacco. And commercial tobacco is the tobacco that the industry uses to target disparate populations and ultimately make a lot of money, whereas traditional tobacco is that tobacco grown by Native Americans and used for sacred purposes. And the industry over time has taken advantage of that and used that in their marketing tactics. So I'm going to play. If you guys could give me a thumbs up if you can hear and see what I am playing, that would be lovely.
When I was growing up, I only knew tobacco to be used in one way, and that was commercial tobacco, smoking cigarettes. Once I stopped smoking, I really started to seek out the other side of tobacco. Learning more about that transformation that took place from medicine for our people to be used to this very destructive thing that kills our people now. And when I started to learn more about traditional tobacco use, I started to realize that it's possible for anyone to change their perspective on tobacco. My name is Clinton Isham. I'm the program director for the Wisconsin Native American Tobacco Network. My main focus is to change the norm that our communities have built around commercial tobacco. The Indian Bowl is an event center that's been around since the 1950s here in Lac du Flambeau and is going to be completely smoke-free. This is a decision that was made by the board of directors, mainly working with Tinker Schumann and Georgine Brown. Our plan is to work with arena directors, the MCs, different drumming groups, the different dancers that come in to get the message out when people are coming into the Indian Bowl itself. We work closely with tribal leaders around smoke-free policies or different health initiatives. What we try to do is make sure that initiatives are as successful as possible and provide any type of support that we can. One example is the Madison Ho-Chunk Gaming Casino going smoke-free.
For quite some time, I was getting comment cards regarding our smoking. Love the place. We love playing here. You got great service. You have fantastic machines. Can't stand the smoke. So I decided that we should look at the possibility of going smoke-free, and came to discover that what was traditionally recognized in gaming, 70% of the players smoke. Our survey really revealed a complete opposite, that really 30% of our players smoked. I also took a look at a study that had been conducted called Gambling with Our Health, and not only would this gaming facility not lose revenue, but in fact, going forward, it would actually gain revenue. We decided that this is something that we needed to do in order for us to provide for a better place for our employees and for our guests. We certainly saw a decrease in our revenues for about 10 months, but we stayed the course. We've recovered fully. In fact, we're doing better than we were prior to going smoke-free. The comments from our patrons, overwhelmingly supportive. Love your place, love how clean it is, love how it smells, just love playing in a place that I don't have to breathe somebody else's smoke.
When we were smoking, we were constantly working in clouds of smoke. You'd go home and it'd be in your hair, be in your clothes, you'd wash it and it would still smell. We had employees, even though they didn't smoke at home, they'd come to work and they would still have quite a few health issues just being in the environment. We went smoke-free, and our employees, obviously their health impact it's been huge for them. They're not having to breathe in that smoke every single day, all night long.
Any native casino that goes smoke-free, I think, sends a really strong message to its community. It shows the concern for the folks that are in that facility, and I think that same concern should carry over into the rest of the community in general, that public buildings should be smoke-free.
These different local coalitions and individuals are doing really great work to address the impact that commercial tobacco has, trying to go back to reclaiming our tobacco.
A long time ago, when I was taught how to grow it and how to take care of it, I understood that in our creation story, the grandmother, when she came down to this earth, one of the things that grew from her feet was this Indian tobacco. We've always used that tobacco to say prayers when we have our ceremonies. When I started learning about tobacco, I realized that our community needed tobacco. Throughout Native American country, it's not available because we've lost so many of our ways, so many of our songs, our dances, our ceremonies, our traditions. And so it's a matter of trying to encourage people to grow this. The bottom line is this originally came from the Creator's land. It's considered our medicine that takes care of our people for all the healing that we have to do. So this Indian tobacco and these seeds I have right here are going to keep on growing. 7 generations past me, they'll still be able to say, my great, 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 great grandmother grew this. And we still have our ceremonies and our songs and our dances and our medicines because she cared enough, because she loved us enough to keep on growing it.
We have a different relationship with tobacco. And so it's important to create policies that respect that ideology of tobacco. And that's exactly what the Madison Casino did, the Indian Bowl did, and it really sends a strong message to Native communities that it's possible to create policy that works for our people. our focus is 10 or 15 years from now. When we ask a kid, what does tobacco mean to you? They don't, say it's cigarette smoking. It's more about traditional tobacco use and what it means to them to put out tobacco in the morning for prayer, and how they're using that tobacco to overcome different challenges.
All right, so hopefully for some of you, maybe that was new information. I know when I first watched that video, it certainly was, or at least, I knew that there was a difference, but I didn't really understand the whole picture. So we're doing some more education around that, especially with our alliance, in an effort to get people on the same page and, help people understand the differences between the two. I forgot to mention too, related to our alliance, our name, we went with nicotine instead of tobacco. And this was one of the reasons we thought about including commercial tobacco prevention alliance. And then we just thought, you know what, instead of doing that, we're just going to have this lens for everything that we do and every presentation that we give, and use nicotine as the word instead, because nicotine is the root of all of our issues related to tobacco prevention, because that's the substance that gets the user addicted to the product. And with all of the new products coming out with e-cigarette trends, some of the products don't even have tobacco in them, and they just have nicotine in them, although nicotine is derived from the tobacco plant. So it gets a little confusing. So we just decided to focus on the actual substance. Okay, so we know tobacco is still a problem in Wisconsin. It's still the #1 cause of preventable death and disease. And not to say other issues aren't important as well, but I think this is one of those substances that we tend to forget about when, we're in an opioid crisis and there's heroin and, the marijuana legalization. There's lots of hot button topics right now. And this needs to continue to be at the forefront. And there's many reasons why. It's not only a huge health burden for the state of Wisconsin, it's also a huge cost burden. So as we saw in that video, there's industry targeting that's happened over a number of years that increase tobacco use. The tobacco industry is very ruthless, and they're very smart, and they have a lot of money. So they've done a lot of things over the years to target the right people who will use their products. And it's worked very well, and it's been a very successful campaign, unfortunately, because we know that nicotine is highly addictive. So once they have the user, their work is done. So I think you guys can move your panel, right? If you can't see the graph, you can move photos or pictures of us on the screen. I just want to make sure you can see what I'm looking at here. I want to bring specific attention to the Native American rate here. It's the highest smoking rate in Wisconsin, 37%. But here you can just see that there are certain factors that increase the risk of using commercial tobacco over others. So some of these disparate populations, you can see the smoking rates are higher, and that's because of targeted marketing and sometimes adverse childhood experiences, stressors, many different factors come into play here. But it's important to note that Wisconsin is at an all-time low for their smoking rates. I think, oh, can you guys hear me? I cut out a little bit. I think our smoking rate is actually 15% now. This graph is a little bit outdated, but lots of other populations have much higher rates still. So this is Nathan. He was a Native American that worked at one of the casinos. This is one of the stories that the Tips from Former Smokers campaign uses from the CDC. You all may have seen those commercials. They're really powerful stories But Nathan never used tobacco. He was actually exposed to secondhand smoke while working at a casino, and he ended up passing away from lung cancer because of that. And so this is really exciting that, you know, Ho Chunk celebrated, I think, 3 or 4 years going smoke free. And you might have seen in the news since COVID happened, a silver lining for prevention is that many of these casinos are opening up smoke free and it's working well. And Ho Chunk reported out that they're making more money now, maybe not this year, but post, you know, no indoor smoking, making more money than they ever were previously. So that's a pretty cool thing. And you know, sometimes we often go to thinking about how is this going to affect the patrons and the customers? We don't first go to, okay, but what about our staff? You know, and unfortunately, Nathan paid the ultimate price for working in a casino. And it's just a good thing that this is moving in the right direction across the nation. So the populations that our alliance has focused on this past year and likely will continue into 2022 is low socioeconomic status, pregnant women, and mental health and substance use illnesses. These are all populations that have higher smoking rates, not just in Wisconsin, but even locally. Like our pregnant women smoking rates are much higher in central Wisconsin than the rest of the state. So here you can see those rates. I'm going to just move this for my own benefit. 1 out of 10 pregnant women smoke in Wisconsin, but in central Wisconsin, you can see it's much higher, really, in Wood County, but our Tri-County area is 14%. So hoping this year to do some more targeted outreach to this population. You know, with this past year and being at a public health department, many of our partners and myself were pulled into COVID response. So it was really hard to dedicate some good work and good time to these issues. So this is Amanda, another story. She's actually from Wisconsin, and she ended up having a baby that was born premature because of her addiction. She used smoking as a coping mechanism, stress reliever while pregnant, in college, beforehand. So she just wasn't able to shake it. And unfortunately, her baby suffered due to that. So one of the initiatives we're really encouraging and promoting is First Breath, which is essentially it's a quit line for pregnant women. So that's one of the projects I would like to work on this year, is to try to continue to integrate First Breath into any site that wants it and works with this population in order to give them the resources that they need if they so choose to quit. So we talked a little bit about this. So things like poverty, low income, increased rates of commercial tobacco use, and this can lead to poor health outcomes. So with that being said, you know, that's why we continue to focus on these populations. Not everyone has a fair opportunity to achieve their greatest level of health, and the circumstances that surround a person's life also increase their rate of commercial tobacco use. So these are public health issues and they're social determinants that impact tobacco and prevention and control, which is why we continue to focus on them. So you might have seen in the news recently that the FDA is looking at banning menthol tobacco products. Menthol is the only flavored cigarette that is actually on the market still. So there's lots of, I see this chat is blinking. Should I pay attention to it, Elizabeth, or no? Okay.
No.
So quite a while ago, flavored cigarettes were banned. This happened when the tobacco industry was essentially sued for lying to the public for many, many years. Menthol was one of the flavors that were not included in this change. So there's lots of flavored e-cigarettes out there still, but like related to cigarettes, it's just menthol. And to no one's surprise, a lot of people use the products. The majority of African Americans that smoke do use menthol products. And the targeted marketing is there's more advertisements in African American communities specific to menthol, and it's just been a very strategic tactic that's worked well for the tobacco industry over a number of years. So with the FDA taking action and considering banning would be huge for public health and huge for prevention. However, with that being said, I actually got called for a media story a few weeks ago about it. And while I'm excited, we know policy moves slow and we know process moves slow in prevention related to the FDA. So I think this will take a number of years. Quote me if I'm wrong, but we'll see. And that would be a really great thing for public health. This is another story, Jerry. She was someone that was always using menthol cigarettes, and it eventually debilitated her enough where she had to quit her job. And actually she was able to quit using products, but she was one that was definitely drawn to menthol. You know, menthol has a minty cooling effect that helps mask the harshness of the cigarette smoke. And because of this, many people believe menthol products are less harmful, and in reality, nothing could be further from the truth. So getting a little bit into youth prevention, we know that products are flavored, accessible, and they're, you know, causing another generation to become addicted to nicotine. I think I will try to play this. The Tobacco is Changing campaign has been out for a number of years. It's a prevention campaign from the state of Wisconsin, but they came up with some new advertisements and some new information that you all can promote in your circles. So if you just Google Department of Health Services Tobacco is Changing campaign, this will pop up pretty easily. I'll just see if this will play here. This is one of their newer
backpacks
ads.
and hoodies with built-in e-cigarettes, vapes that look like makeup and smartwatches. Tobacco companies are keeping young people hooked with products that hide a dangerous nicotine addiction in plain sight. Tobacco is changing, parents. We've got to keep up.
So what did I do here?
Our kids have to
I use Tobacco is Changing a lot, like even when we get media stories, and the last question asked is there anything else you want to share for us? And Tobacco is Changing is what I use a lot and what we promote to the school districts, because there's really nice resources that can easily be embedded into social media. And if you're just trying to get up to date on the newest products and you don't want to spend a day researching, this is a good place to start. So we've done something like this perhaps in the past. If you've attended our presentations, we're gonna do a little play here. So there's still a lot of products out there and they continue to evolve to be easily concealable, different e-cigarette trends and products, devices. So with this being said, in this image, there are 6 e-cigarette related devices. So it might not actually be the device, it might be a component of the device, but I'll give you a minute here and see how many you can find. So again, there are 6. And to be honest with you, when I first looked at this, I could only find 5. So hopefully you found all of them. You are a tobacco prevention expert and you are hired. Just see which ones you got right. So I'm going to go from the bottom to the top here. So that STIG device next to the flash drive, that actually is a e-cigarette. And then going up, Juul, you can barely see it. It's that's an e-cigarette product. And when I say e-cigarette, I mean electronic nicotine delivery systems. That's just the short version. They're all intended to do the same thing, and that's have the user inhale whatever is in the product. And then going up on the left side, that yellow device, that's called a Swarin. That is an e-cigarette as well device. To the right is a cartridge for Juul. That looks like mango flavor. That's actually no longer allowed to be sold on the US market anymore, which is a good thing for public health. And in the pencil box on the left-hand side, there's an old school vape pen. I don't see those as much in the districts now, but they are still sold. And then on the right, to be honest with you, I can't quite tell what this is. It's clearly some type of e-cigarette device, but this just goes to show you, the products are designed to mimic other youth items, increasing their appeal and making them easy to camouflage from parents and school administration. So things are continuing to evolve here. The districts locally have confiscated many different types of varieties of these products, probably all of them. I'm thinking of one school in particular, just had a pile of products. And here I am thinking like, oh, all the kids are using Juul, right? Because that's all we hear about. No, there's anything and everything across the board. Okay, so I'd be remiss if I didn't talk about COVID here. So there was some information in the media that came out a bit ago related to COVID-19 and e-cigarette use. People with lung issues, I think most of us know, are more susceptible to more severe COVID illness. And people who are at higher risk for COVID tend to be the same people who are disparately targeted by big tobacco and using their products. So there was some research that came out related specifically to e-cigarettes that young people who have ever used e-cigarettes are more likely to be diagnosed with COVID-19. So there is a correlation, there's not causation, meaning e-cigarettes don't cause COVID-19, COVID-19 doesn't cause e-cigarette use. But what it does mean, it might not, it could lead to a higher severity of illness for like commercial tobacco users like cigarettes, but for this, it just increases the likelihood of getting it. And that is actually more related to behavior, such as sharing an e-cigarette device, that hand to mouth, more exposure to germs on your hands, not necessarily the actual inhalation of the product, if that makes sense. Okay, so we do have quit resources available for people that are suffering from secondhand exposure and firsthand tobacco use. Just wanted to mention that, and we'll talk about that a little bit more. But main focus this year and last year, coming years, tobacco-free schools, of course. Statewide initiatives in terms of meeting with legislators, people who make decisions related to these policies and the people affected by them. We want to meet with those people as much as we can and bring our alliance members with and help them understand what the issue is. Some of you may have attended those meetings with us in the past, and we certainly appreciate that. And related to the Wisconsin WINS program, I believe Elizabeth gave an update about this at one of the meetings this year, but just as a reminder, we haven't been able to do compliance checks this year, which normally with the WINS program, we go to retailers with youth and law enforcement, attempt to purchase in order to ensure that retailers are following the law and they're not selling to minors. So this happened due to COVID, but what's also unique and tricky about this is that these checks stopped this at the same time Tobacco 21 happened, which is a federal law that prevents anyone under the age of 21 from purchasing tobacco products. So if and when we ever get back out there, we have to wait to get the green light from the Department of Health Services to do these checks. I'm interested to see what the sales rates are like. So stay tuned for that. We still do a lot of outreach to our retailers though, just to get them the resources they need and help them understand what they need to do to follow the state statute. Okay, I won't keep talking too much here. You can see these are some of the main initiatives that we work on, not only locally, but statewide. I think I mentioned most of these, but collaboration and partnerships is really how we move this work. And I'm gonna move my screen again here. This is just a very busy timeline to show you that this work has been going on for quite some time. So 2019, that's when the Tobacco 21 bill passed. 2018 is basically when the e-cigarette epidemic happened and everything was going crazy related to that. We have to remember, before there was a COVID-19 pandemic, there was an e-cigarette epidemic. 2014 is when a lot of the local e-cigarette, smoke-free air ordinances were updated. Actually, back from 2014 up until now, there's a ton of local municipalities that have updated their policies to include e-cigarettes in their clean indoor air workplaces. And then 2010, that's when all workplaces and restaurants went 100% smoke-free. You might have remembered that. That was only 11 years ago now. And we're going to play a video at the end to remember that and celebrate, because it wasn't that long ago. But while we're so focused on so many other issues, we kind of forgot that, you know, that was a huge deal for public health and residents in the entire state of Wisconsin. And then the Master Settlement Agreement happened in 1998, and that's where the tobacco industry was sued for a lot of money and for lying to the public for many, many years. That money is gone now. A lot of people assume that we're funded through the master settlement monies, and we are not. We are funded through the general Wisconsin state budget. We're funded at what, a 10% of what the CDC recommends, but I think we do a pretty good job with the funds that we have available. So with that being said, I mentioned this in the beginning of the presentation, tobacco still costs the state a lot of money. And there's a reason why we need to continue to do this work. So I did mention I wanted to play this video. So can you guys do a hand raise? Were any of you involved in the smoke-free air work, making Wisconsin smoke-free in indoor places? Raise your hand if you were. It's okay if you weren't, but raise your hand if you remember that happening, if you have a camera. Yeah, okay. So 10 years ago, Wisconsin went smoke-free in indoor places. There was a lot of drama behind it, a lot of pushback. It happened through local policy work. So these ordinances passed locally before they passed the state, which often happens not only for this, it's a pattern for Wisconsin as a whole, and it's especially a pattern for tobacco prevention work here. We have many things that we cannot do locally due to this thing called preemption, but local smoke-free air ordinances was something that we could do, and including e-cigarettes in local smoke-free air ordinances is something that we can do. So I'm going to end by playing this video, and then we can open up for questions, and Elizabeth can cut us off when we are running out of time. But I think it's important to take a step back and celebrate, especially with COVID-19 and how polarized our political environment has been right now. When I watched this video, I was like, wow, this is really a breath of fresh air to see people working together on a common issue for the betterment of everyone. It sounds cheesy, but it was really nice, especially working in public health this year. It felt good to reflect and celebrate.
My son had respiratory challenges for many years. There's no way I would have felt comfortable with him inhaling secondhand smoke. And so I'm so grateful that our state is smoke-free. Of all the things I have to be concerned with about my children, secondhand smoke is not one of them.
Making indoor environments smoke-free saves lives, pure and simple. If an individual is around someone else who is smoking, that individual is at risk for lung cancer, heart attacks, and other significant health outcomes.
Could you imagine that today if you went into a restaurant and sat down and at the next table somebody lit up a cigarette? Imagine walking into your workplace and having somebody light up a cigarette next to you. It would seem so shocking and so out of place.
It's been 10 years since we implemented the statewide smoke-free air law.
This 10-year anniversary is a true celebration. Smoke-free laws protect everybody's right to breathe clean air.
No one should have to choose between their job and their health.
By making it a smoking-free environment, you're keeping your staff and your customers safe.
This had been a goal for a long time, and people had worked so hard at it.
The local units of government got tired of waiting for the legislature to make a decision. And so various units of government had their own smoking legislation.
So La Crosse County was the first county to enact a smoke-free restaurant ordinance. It really was that local neighborhood approach, educating people about the impact of secondhand smoke.
People could see in their own backyards that it was something good that people generally liked and generally was better for people's health.
I think that's what really ignited the opportunity to continue passing local ordinances that grew into the statewide smoke-free air law.
And there was a group of very well-organized, smart, effective teen advocates that came up to the legislature that really helped make the case that this was something important for the future of Wisconsin.
Yeah. I actually went to the Capitol and held rallies with hundreds of kids. And it was amazing to see the energy that they had. They just kept at it and they really believed in it. Their voice is what made things change.
So for me, it was really exciting because it was my first experience as a young person to really see if you want something to change, you can actually go and speak to people elected to represent you who are there to really hear what you have to say.
Democrats and Republicans passed this bill. It wouldn't have passed by one party or the other. It took members in both parties.
And the harms of smoking don't just affect Democrats or Republicans.
So it was people from different parties, different points of view, but we all had one thing in common, is that we wanted to make it easier for people to live and work in a safe environment.
When it finally happened, I was like, wow, this is really it. Almost disbelief.
There was celebrations everywhere. Just seeing all the people that came.
It was just really, really exciting to see it happen and to know that we made history.
My son plays music, and the day that he got to go in a bar and not be surrounded by smoke made me feel really good.
And all of the doomsday that nobody would ever go to restaurants again didn't happen.
My business changed absolutely not at all when we went smoke-free.
And in fact, we're much healthier because of it.
By passing Smoke-Free Wisconsin, we've protected residents of our state from unnecessary exposure and danger from secondhand smoke.
These laws not only save lives, but they ensured indoor air quality, they helped people and encouraged them to quit, and they discouraged our youth from ever starting.
Well, I congratulate and thank everyone who worked so hard to get the smoke-free law passed.
During my public health career, I believe this is the largest success that I ever experienced.
Congratulations, Wisconsin, on achieving 10 years of smoke-free air.
You've done it. You have made workers healthier by keeping Wisconsin smoke-free.
Don't take it for granted. Make sure that you share the success and tell the story of how we got to where we are.
Congratulations to the state of Wisconsin on 10 years of being smoke-free. We have work to do still. I hope that over the next 10 years, we decrease disparities as it relates to tobacco use. So congratulations, and looking forward to the next 10 years.
All right, so I want to leave you with this message that, you know, as we wade through the waters of all the challenges in our world right now and just everything that's happened and gone on, I hope that that video leaves you with some hope that we can come together to get through uphill battles, and we can look back and be proud of our efforts and accomplishments. And yeah, this video just really makes me smile, even though I wasn't involved. It's really cool, and it's just a good reminder that we do need to take time to celebrate our accomplishments. So with that, we can open it up for questions. I did want to leave one note here. We're going to be providing you a Google Drive folder with some of the resources I talked about today and some information about our alliance. I'm guessing Elizabeth will probably include in minutes or the next AOD updates, but I'll stop talking there. Perfect.
Yeah,
I
so
see she added it.
Yep. Yeah, I just sent it in the chat. I will send a follow-up email though, since like I said, we are recording this presentation. So it'll include the recording and then also, yeah, the link of resources. And earlier I did link some information on First Breath. So Jenna, when you said if you should ignore the stuff in the chat, I said yes, because that was just those items. Yeah, if there are any questions, feel free to type them in. I did see that Jessica asked if we can include all the video links that we saw today too. So I don't know if those are included in I don't think they are included in the Google Drive, but maybe if you can just email those to me separately, I'll send those as well. All right.
Yeah, and I encourage you to use that. I mean, if you're able to use that somewhere, if you work in anything related to prevention work, not even tobacco prevention, but any type of policy work, if you're in law enforcement and you've had people working with the Wisconsin WINS program, if you work with youth, I just think that smoke-free air video is just a really, really cool thing. And we should share it, and we should continue to celebrate.
Perfect. All right. And another question, are the videos able to share public? Oh, sorry, you did answer that. Yeah, thank you.
Yeah, so I will say the commercial versus traditional tobacco video, that one is a little bit, it's not super old. It's probably from 2017. It's all relevant content still. The staff who supported that video are no longer at that program, but I don't know, I still use it. So if you found it powerful and useful, I'd say go for it.
All right, awesome. I'm not seeing any other questions coming in, but definitely feel free if any come to mind. We still have about 12 minutes left, so you can still have time to type them into the chat, or you can unmute and ask as well. But yeah, no, I appreciate the presentation, Jenna, and just all the work that you've done. You know, I think there's still so much work to be done, definitely. I feel like since, you know, the statewide smoke-free Air Act happened, a lot of people kind of gloss over tobacco and nicotine and think that there's, you know, things are fine now, but really there is still a lot of things to happen. And I think back to when we did the retail assessment project assessments back in, I think it was 2019. And, you know, we saw the like toy display right next to like the little cigars. And, you know, I always think back to that because I'm like, there's still so much work that can be done. So, but yeah.
Yes, it's an uphill battle. And I think watching videos like that and just doing presentations like that even remind me and motivate me and as to why we continue to do this work. I just wanted to mention one more thing too. So for those of you that have attended or were thinking about attending our meetings, you know, I generally attend these meetings too, and any other prevention meetings in Portage County. And that's a good way for you, you know, if you're extended, if you can't attend every meeting that you're invited to, which I understand, that's a good way to get our updates as well. We also have a monthly update that we send out through our alliance. We can also include a link of how to get signed up for that. And I will include one more flyer in that resource folder that has all our meetings for the upcoming year. We're going to meet quarterly on Thursdays, and Right now they're scheduled all to be virtual, and they work virtual. Actually, we always did hybrid even before COVID, because with being a tri-county area, it's tricky to get everyone in the same room. So with that being said, that may open up an opportunity for you to dial in. Maybe you wouldn't have otherwise. So we'll have that information in there for you too. Thank you all.
All right, perfect. Yeah, and thank you again, Jenna. So in our last 10 minutes, I do just want to share a couple of updates of things that the coalition is working on, upcoming events, different things like that. And if we have any time left over, we can do some quick member updates, but I have a feeling we won't. So please, if you have any upcoming events or things that you would like to share, please email them to me. I believe everyone has my email at this point, but if you don't, I'll put it into the chat right now, just so that way you can just send me any updates you have. And like I said, I will share them out in the follow-up email from this presentation. But yeah, so first things first, I'm going to share my screen really quick and just promote an upcoming event that we have on August 5th. It's free. It's called High in Plain Sight. It's a substance abuse prevention training. So this training, like I said, it's free. It's on August 5th. We have a new time, actually. Originally, we were hoping to have a morning session and an afternoon session. However, we noticed that the afternoon session didn't really have super high numbers, so we decided to combine it into one. So now it's from 9 a.m. to 3 p.m. We'll have a working lunch in there. It's at the UWSP Dreyfus University Center Theater. And the instructor is Officer Jermaine Galloway. He's a national speaker. He is very, I'm trying to think of the word, he's just very well spoken, and he's very knowledgeable about drug culture, drug trends. He is graciously doing a community assessment of some of our vape shops in town before the presentation, and he's using that to, I guess, inform, just that presentation and some of his talking points. So I just put the sign up link in the chat for anyone who would like to attend who hasn't signed up yet. I just checked the numbers, and we only have 10 spots open right now with capacity limits. So if it is something that you want to attend or you want to share with someone, please do so right away, because that looks like it's going to be filled up pretty quickly here. And we won't be offering a virtual live stream for that event at this time, unless something changes with COVID policies and practices. But so definitely feel free to attend if you are able to. We would love to have you. Two other things really quick, just things that are on the coalition's radar. So some of you may have seen in the news, but an alcohol to go bill recently passed. It's called SB 22. And what this entails essentially is that taverns, bars can now sell alcohol to go, mixed drinks, whatever it may be, to people through like an online sale or telephone sales. There is no food purchase requirement, so people don't have to buy food in order to get a mixed drink. There's no container limit or size. So something that we're doing is we're actually talking with the Tavern League about that in a couple of weeks, and just seeing, where things are at, I guess. In our initial conversations with them, they did indicate that they still have a lot to learn about the bill and the implications of it. So we're hoping to do just an open discussion and just, really inform them. This is what the bill says. This is what we recommend for best practice, especially to ensure public safety if you are making these sales. But from the initial conversations that we've had, most tavern owners do want people to be drinking in their establishment. So they indicated that they more than likely would not be using it. But either way, they definitely wanted just to start the discussion and to learn more about it. So going to be a good conversation, I think, and hopefully we are able to, I guess, really just, yeah, keep that line of communication open and have a good impact on that. So the other thing I wanted to note is, if you recall, I believe it was last November, I had mentioned that we were talking with an organization called Vivint Health on bringing the syringe access and disposal service to Portage County. So a couple of weeks ago on May 10th, I spoke with our Board of Health at Portage County about this program and just the potential to bring it here. It was a very lengthy discussion. We know that the people who would be using the service are IV drug users. You know, there's no question on whether they're using it for a medical need or anything like that. So it's maybe a little bit more controversial, I guess, in that regard. However, this site would bring referral to treatment as well to these individuals and really opens the line of communication to these folks. We know that through similar programs, people who use access points such as this are more likely to enter treatment. They're more likely to go into recovery from their addiction and their substance use disorder. So really, it's a positive step in the right direction. The Board of Health did not meet last night like I thought they were going to. So those minutes and that motion hasn't been fully adopted yet. It will be in June, but then we're hoping we can start some more firm planning to bring that site to Portage County Health and Human Services. There is a location in Schofield, which is about 20 miles north of Stevens Point. And we did see, based off of 2020 data, that there were close to 500 people Portage County residents who used that service. And there were, I want to say, like close to 70,000 syringes that were given out to those individuals. So there is definitely a major community need. Through partnering with Vivint, they provide pretty much everything for free. The only thing that we have to provide on our end is the space to utilize the service, and also just the staff time as well to have someone there to make the exchanges. So we'll see how it goes, but we're excited about the opportunity. This has been a discussion in Portage County for a few years now, but now we're in a position to finally move it forward. So, but yeah, if there are any further comments on that, we always welcome them, and again, want to keep the discussion open. And we are hopeful that this program will be a good service to Portage County. So on that note, like I said, there's a couple of minutes left. I know I didn't allow time for other people to share updates, and I apologize for that. I usually do. But I put my email in the chat, so if there was anything that you would like included in the follow-up email, please just let me know and I will include it. But yeah, are there any questions really quick about any of those items? You can feel free to type them in or unmute, whatever you're more comfortable with. Okay, I'm not seeing anything. Jenna, no need to apologize about having a longer presentation. It was very good, and I think everyone appreciated it. So yeah, all right. Well, oh, sorry. Is there a question?
No, someone left.
Oh, okay.
Yeah. Jenna, thank you. It was a great presentation.
Yeah.
Thank you, everybody.
So thank you, everyone. Have a good summer. We'll see you again in August.
Wow.
Wow.
All right. Thanks, Elizabeth.
Yeah, thank you, Connie.
And I am, hold on.